Assalamu alaikum. I am Pervin Akter, Professor and Head, Department of Physiology. Today I am going to deliver my lecture on sensory tract. Okay, so let's start. What is tract? Tract is a bundle of nerve fiber in the central nervous system that carry one or group of senses, either sensory or motor, to the brain or from the brain. Ascending tract, all are sensory, and descending tract, all are motor. Now I am going to start my lecture on sensory or ascending tract. And what are the sensory or ascending tract? Sensory tract, almost all the sensory information from the somatic segment of our body enter the spinal cord, so the dorsal root of the spinal nerve, and then from the sensory signal from the entry point it enters into the spinal cord to the brain, carried either into the dorsal column medial lemniscal system or into the anterolateral system. And ascending or sensory tract, dorsal column medial lemniscal system occupies the dorsal white column of the spinal cord and then carries signal to the medulla of the same side. Then it goes to the opposite side and form the medial lemniscus, and then passes through the brain stem and then into the thalamus. But in case of the anterolateral system, after entering the spinal cord, fiber synapse into the dorsal horn cell and immediately goes to the opposite at the same level, and then ascend through the anterior and lateral white column and terminates all level of the lower brain level and then into the thalamus. This is the main difference of the dorsal column medial lemniscal system and the anterolateral system. In case of dorsal column system, it transmits sensation that need rapid transmission and final sensation. But in case of anterolateral system, it transmits that does not need to be transmitted rapidly and CUDA sensation. In case of dorsal column system, it composed of large myelinated nerve fiber, but in case of anterolateral system, it composed of similar type of myelinated and unmyelinated fiber that transmit signal at lower velocity. In case of dorsal column system, it limited to transmit discrete type of mechanoreceptive sensation and ability to transmit a broader spectrum of sensation. What is the tract? Tract is composed of within the dorsal column system. It composed of the tract of Gall and tract of Budak. And in anterolateral system, in anterior column, the tract is anterior spinothalamic tract, in lateral column tract is the lateral spinothalamic tract, and other tract are spinocerebellar, spinovestibular, spinoolivary, spinotectal, spinoreticular and spinocortical. And what are the function of the dorsal column medial lemniscal system? It carries the sensation of the fine touch, kinesthetic sensation or position sensation and vibratory sensation. And function of the anterolateral system, anterior spinothalamic tract carry the sensation of good touch and pressure, and lateral spinothalamic tract carry the sensation of pain and temperature. And spinotectal tract related to visual reflex, spinocerebellar related to posture, spinovestibular related to postural reflex, spinoolivary related to postural reflex, and spinoreticular related to consciousness and awareness. Before going to the course of the tract of Gall and tract of Budak and other anterolateral system, we must know what is the Bell-Mezendy law. In spinal cord, the dorsal roots are sensory and ventral roots are motor. This is called the Bell-Mezendy law. Now we are going to start the course and termination of the tract of Gall and tract of Budak. Tract of Gall is also called the fasciculus gracilis and tract of Budak is called the fasciculus cuneatus. Origin: it is made up of axon of the bipolar cell of the posterior root ganglia. Tract of Gall receiving the afferent fiber from the lower half of the body and tract of Budak receiving fiber from the upper half of the body. And course: first order neuron is axon of the dorsal root ganglia, it enters into the spinal cord, so the dorsal column and in the dorsal medulla. Then synapse in the dorsal column nuclei, tract of Gall is synapse with the nucleus gracilis, and tract of Budak synapse with the nucleus cunate nucleus. Then second order neuron arise. Second order neuron then decussate immediately into the opposite side and brain stem along with the medial lemniscus and enters into the thalamus, and third order neuron arise. Then it passes through the posterior limb of the internal capsule and in the postcentral gyrus of the cerebral cortex. And this is the figure of the tract of Gall and tract of Bodak. And what is it is the lateral spinothalamic tract and origin. The axon of the first order neuron enter the spinal cord from the posterior root ganglia, and it diverges into anterior ascending and descending tract, and it synapse with the cells in the substantia gelatinosa cell, and second order neuron arise. Second order neuron then goes obliquely to the opposite side of the anterior and white commissure of the same segment and ascend in the lateral column as the lateral spinothalamic tract, and then ascend through the medulla oblongata and accompanied in the anterior spinothalamic tract and form the spinal lemniscus, and then pass through the pons, midbrain and fibers and by synapsing with the third order neuron in the ventral posterolateral nucleus of the thalamus. And third order neuron then pass through the posterior limb of the internal capsule and terminate in the postcentral gyrus of the cerebral cortex. And what is the pathway of the pain? Its receptor is the fin up ending. Fast pain is delta A fiber and slow pain is the C fiber. And what is the pathway of the pain? Sensory nerve from the receptor enters into the spinal cord through the dorsal root ganglia, synapse in the posterior horn cell, and second order neuron arise. Second order neuron then goes to the opposite side of the same segment of the spinal cord and then ascend in the lateral column of the cord as the lateral spinothalamic tract, and then it passes through the midbrain, pons and medulla and terminate in thalamus, and third order neuron arise. And third order neuron is terminate in the postcentral gyrus through the posterior limb of the internal capsule. And this is the figure of the pathway of the pain. And what is the referred pain? Referred pain is the irritation of a viscous frequently produces pain which is felt not in the viscous but in some somatic structure that may be considerable distance away. Such pain is said to be referred pain into the somatic structure. And the mechanism, what is the mechanism of the referred pain? Branches of the visceral pain fiber synapse in the same second order neuron that receive pain signals from the skin. So, when a visceral pain fiber is stimulated, pain signal from the viscera are contacted through the same neuron that contact pain signal from the skin, and person feel that this sensation is originated in the skin itself. And what is the dual pain pathway? There is two types of pain, the fast sharp pain pathway and the slow chronic pain pathway. Fast sharp pain pathway for pain receptor is the fin up ending, and receptor is the delta type A delta type fiber with a velocity between 6 and 30 meter per second. On entering the spinal cord, they terminate in the lamina 1 or lamina marginalis of the dorsal horn and give rise to second order neuron of the neo-spinothalamic tract, and then give rise to long fiber that goes immediately to the opposite side of the cord through the anterior commissure to the brain in the anterolateral column, and few fiber then of the neo-spinothalamic tract then terminate in the reticular area of the brain. But most of the fiber then pass all the way to the thalamus along with the dorsal column medial lemniscal tract for tactile sensation. And from this thalamic area, this signals transmitted to the basal area of the brain as the somatosensory cortex. And for neurotransmitter for the sharp pain fiber for the is the glutamate. Slow chronic pain fiber, the pain signal is transmitted by the type C pain fiber. On entering the spinal cord, they terminate in the lamina 2 and lamina 3 of the dorsal horn of the spinal cord, which together call the substantia gelatinosa. Most of the signal then pass through the one or more additional short fiber in the dorsal horn and then give rise to second order neuron of the paleo-spinothalamic tract. They give rise to long axon that mostly join to the fiber from the fast pain pathway. Then goes immediately to the opposite side of the cord through the anterior commissure and then enter into the anterolateral horn and lateral spinothalamic tract, and then slow conic paleo-spinothalamic pathway terminates widely to the brain stem, but only 1/10 to 1/4 of the fiber then pass all the way to the thalamus. And then this thalamic area, these signals are transmitted to the other basal area of the brain as well as to the somatosensory cortex. So this is all about my lecture on the sensory tract. So Allah Hafiz. Assalamu alaikum.